Hello.
Hey. Are you filming already?
How are you? Hi. What's up?
Hi.
Nice to meet you.
Nice to meet you.
Hi.
We'll proceed to level 5 actually, but this is our office.
Okay.
Yeah.
So, do you like to live here in Singapore?
Generally, yeah, I've been living here for 30 years now. Don't like the weather. Yeah, living standards here are generally okay, I guess. Living here as a gay person, as a person living HIV, then that's a separate story altogether.
Oh.
When I learned that I was gay I knew there was something different when I was very young, and even at the age of 10 I knew I was different, and by the age of 12 when there was internet, then you start to search for things, and that's how I learned I was gay. That's how I learned I come across the word homosexual and gay, what it means to be that, and it felt very natural to me, but at the same time very out of place, because there's nowhere else on television, on magazines, newspaper that you get to meet or read about something like that here. So it felt very out of place. And with HIV, it's just a little tiny topic that's been brought up in school, and back then it was still about how HIV don't have premarital sex. You have that, you might get pregnant and you might have HIV or other STIs, and how scary HIV is or other STIs are. They will show some quite scary photos of rotting genitalia, and so they were still based on fear tactics, and that was that. So being gay while receiving sex education in school didn't make much sense as well, because sex ed is all about, it's a very heteronormative subject, and so half the time we just switch off, we don't pay attention. There is no need to pay attention about how a condom works, why we should be wearing condoms, and so you just don't learn about condoms. Yeah. Then subsequently, when I came out to my parents when I was 17, that I was gay, we didn't speak for nearly 8 years. Yeah, it took a long time for her to accept. And after that, I was diagnosed with HIV. So it only made things worse, because when I came out to her, her first reaction was, "You are going to die of AIDS." Yeah, and it made it even tougher for me to come out to her that, "Hey mom, you're right. I have HIV. I'm not gonna die, but look, I have HIV." So yeah, that was tough.
When was that? So you came out as a gay man
when I was 17, and that was the early 2000s. Yeah.
And then?
And I came out as a person with HIV in 2012. I was diagnosed in 2009, and I only told my parents in 2012. Yeah.
And how was it, the whole process?
Many things have changed since I came out to her as a gay person. We had the 8 years that was virtually missing in my life, and she was there around, although she doesn't acknowledge that part of my life. She doesn't acknowledge that I was a gay person, and she was still hoping that it was a phase, and that I will grow out of it. And so shortly after that, I joined AFA, and also her concerns were whether I would contract HIV, because I had to help or work around persons living with HIV. So that was her idea of what HIV was and how it might transmit. So I had some time to educate her what it was, and I would start by slowly bringing home some of our materials and some of the the videos that we do, we'll leave them at home, and she has time to look through them and slowly learn. And so she had a long time to ease her into what it meant to be gay, what it means to what HIV is, how it has progressed. And so when I finally came out to her in 2012, her reaction was, "Why didn't you tell me earlier? Do you need help with treatment? Can you afford treatment? Why did you wait till so long before you tell me?" Yeah. So she went from someone who told me I'm going to die of HIV at one point and wouldn't speak to me about anything about with my life and with me being gay, till she's now joining me on stage, and she's very ready to speak about it. She's ready to share her experience of her son being diagnosed with HIV. And yeah, so she's taken a lot of courage to be where she is now. Yeah.
And your dad, if I may ask?
The strange thing was when I came out to my mom in 2012, and so I asked her, should I tell Dad or will you tell Dad? And she went, let's just keep this a secret between the both of us for now. It was only after I did another interview on a Chinese program, then I told my mom that it's going to air this time. Then my grandma was watching, my aunties were watching, and I think he was over at my grandma's place as well, and then that popped up. And my auntie called and she was crying. That was only when I know that my dad learned about it, but my dad being an Asian dad does not speak or does not emote directly to the children. So he speaks through my mom. So he'll ask the same things. How am I coping? How am I dealing with it? Can I afford medication? Yeah, but in his very silent, behind the scene kind of way, that he shows his support.
Why do you think that his reaction was different to your mom's reaction?
He has always had difficulty expressing himself. He always find it very difficult and a chore to show and express his love to his children. That was how he was brought up, because my grandpa was that way too. My grandpa is very distant with his children, and so he was brought up that way. Yeah, my mom, she grew up in a huge family. I have over 70 cousins. I've lost count of how many aunties I have and uncles I have. So huge family, and she's used to that. So yeah, and she was a baby in the family. So she was English educated. So there was a little bit difference in there, and the way she was brought up, and she reads up a lot as well. So she's very modern during that time when it comes to parenting and how to cope with issues like that.
And how was for your dad when you came out as a gay man? You just had an HIV.
Oh, wow. Even till last year, he was still hoping that I would get married somehow. So then I had to go through the whole to a woman and have children, because that's the only concern. If I will grow old, lonely, there's no one to take care of me. So we started this whole debate about why can't I get married? Why does marriage have to be between a male and a female? Why can't I adopt a child? If I can adopt a child, then I won't be lonely in that sense. Right? So there'll be someone to take care of me. And slowly they seem to buy into that idea. So we have been thinking about marriage.
Abroad?
Abroad, definitely. Can't get married here. Yeah. And to figure out how to get children if we want to.
What are the thoughts?
It doesn't seem like a straightforward. We haven't really researched much, but it doesn't seem like it's a very straightforward approach if we want children. Yeah, but definitely something that it's on the cards, and we would like to have one or two if we can afford, or if we're being allowed to do it. Yeah, my partner wants to go though, because he would like to live his princess fantasy through her. So the whole
Is he from here as well?
crown thing. Yeah, he's a Singaporean.
Talking a bit more of you living with HIV, how is it to live with HIV here? Asking the concerns of your parents as well. How is it to access your health? And
things have certainly improved over the years, and it's always improving. The last person who came out publicly was 15 years ago, and yeah, it took 15 years before someone else came out publicly. So it only says about the status or the environment of what it means to be living HIV in Singapore. In 2001, there was a documentary done where the director went to the streets and interviewed people about how they feel. So he wanted to do a follow-up 10 years later in 2011. In 2011, I was tasked to do and try and look for people to accept interviews, persons living HIV to accept interviews, because there was one other person in that documentary who was willing to accept the interview. 10 years later, we couldn't get anybody. I was contacting about 10 to 15 people, and everyone rejected. I took that as a reflection of the climate and the stigma associated with HIV in Singapore at that point, and in 2010, 2011. So I couldn't understand why no one wanted to step forward to accept the interview. But they had very real and very valid reasons. Amongst them were medication was working so well. I have no reasons to come out unnecessarily. There are a lot of people around me, my family members, my co-workers, that don't know that I have HIV. They can't tell anyway because treatment's working so well. So why do I want to come out now and rock the boat? Right? If everything is calm, and I want to keep it that way, which is fine, which is fair for them. So that project started my process of coming out, my eventual coming out in 2012. It's because if I cannot find a good reason enough for them to come out, and for myself to come out, then just no one will come out. And so I started looking for reasons. I started looking for platforms and how to create them and how to allow people to safely come out. We get calls on a regular basis on our helpline and asking us things like, can I wash my son's clothes? He was recently diagnosed with HIV. We have a newborn baby coming out. We have actually asked our son or our relative to move out because he has HIV. We're very worried that he will infect the baby or infect an elderly. And we had to spend time to educate them. In most cases it works if we have the chance to educate them and try and mediate that. But there are still cases where individuals are forced to leave their homes because not only they are coming out, many times not only are they coming out as a person living with HIV, they're also coming out as a gay person as well. And sometimes these disclosures are not planned properly, so they are thrown in the deep end, and both parents and the person have no idea how to handle it.
Do you have any data, any information on MSM or gay men with HIV, not living with HIV, straight?
It's predominantly male. 91% of all new infections are male. 9% are female. on average. And out of the 91%, about 50 odd percent are straight men, and the remaining are gay or bisexual.
Okay.
Yeah.
So in fact, there are more straight men that are.
There are, but if you're looking at the gay population, gay men population, we are only looking at about 120,000 gay men in Singapore. And that contributes to 40% or slightly more, almost half of all new infections. So then the prevalence rate is much, much higher. We think about 80% of that 120,000 gay men in Singapore are either in the closet, or they don't access services, or they don't access the gay clubs where education programs are primarily held. Because we cannot run education prevention program on mass media, not on televisions, not on any broadsheets. So we are relegated to either gay clubs, saunas, or online. So if they don't access any of this, then we're not reaching them. So whatever campaigns we do, we're only reaching out to that small pool of people.
Okay.
You will never achieve critical mass.
And access to help, how is it for you?
Generally, there is very good access to health for Singaporeans and PRs here. As long as I'm willing to go through the system and be part of that, then I have access to clinics, I have access to doctors who are, like I shared earlier, they are incredibly caring, nurses who are, and services that are non-discriminatory to persons living with HIV. So generally speaking, it's not too bad. Yeah, treatment-wise, it's still very expensive here. There is no subsidy for medication, so everything you have to pay out of own pocket. Original Atripla, which is one of the most commonly prescribed medication here, would cost $475 a month if you buy from a local hospital.
And does your insurance cover this?
No insurance in Singapore covers HIV at the moment. So if I were to seek treatment in Singapore, that means that my particulars would be submitted to the ministry. As a Singaporean and as a permanent resident, that doesn't have much consequences. But if I'm married, that means my spouse will have been notified, my family will be tested, and it's mandatory. If you don't do it, the government will do it on your behalf. If I'm gay, then that's fine. But my information will be submitted to the government. There will be an interview by the ministry where they will try and ask you what your sexual orientation is, and although it's purely for data collection, it doesn't translate to any criminalization or penalties per se. But then it goes on to affect the insurance. It goes on to affect if you're applying for a job in the healthcare industry or a government public sector. Yeah. So the record is there. If an individual is tested positive who is on any long-term pass here, they will be asked to leave Singapore. They'll be sent home. In the past, they couldn't return even as a tourist. But that's changed recently. They can actually return on short-term visits now. But they can no longer apply for a work permit, a student permit, or if they want to convert from a visa to a permanent resident or permanent resident to citizen. That's all out of question. We are one of the, I think, 14 or 17 countries in the world that still practice this kind of travel restrictions.
And what's the argument that they use? Do they want to avoid epidemics?
Yes. Yeah. They just want to reduce. They want to reduce reliance on the system. They want to reduce the prevalence rate.
And what would be the inclination towards persons living with HIV here from the state?
On paper, it sounds like they don't encourage discrimination. They have made certain improvement in that sense by setting up task force to help reduce stigma and discrimination at the workplace especially. And they have also invested quite a bit of seed money for education programs, for research programs. So we cannot say that they are not supportive. Yet there are no clear laws or legislations in place to protect persons living HIV. A person can still be fired because they are living HIV. And there are no clear indication of what protection there is.
And does it happen?
And yes, it has happened. Yeah. But because of how it works here, people who are being fired will never want to speak up as well. So then there is a constant spiral of silence. They don't want to come out, they don't want to face the media, they don't want to go to the ministry to lodge a complaint because that could translate to further stigma. So they just decide to just not talk about it.
Yeah. Have you been discussing about PrEP here? Have people been using?
PrEP hasn't been officially allowed to be used here, or Truvada is here, but it's not been licensed for PrEP yet. And so we have had a little bit of discussion here and there because we know that people within the community are using it. Some of them are heading up to Bangkok to buy Truvada and using it as a PrEP. Some people are importing into Singapore and selling them as PrEP. And we have no choice but to at least educate them and let them know what to do, what to expect, what are the blood tests you need to follow up. You can just take PrEP as and when you like, So I think we could do with a lot more discussion when it comes to PrEP. We just recently published an article on our website on how to and what to expect if you're considering PrEP and if you're already on PrEP.
If you could just say like a general overview of what you think about using PrEP, and because we talked to other few people, but maybe it would be nice to have someone explaining and like what it is and the risks, what you should take.
Many people still don't quite understand the idea of PrEP, and so we have seen people who are on Grindr saying that they are on PrEP, and since they're protected that way, they can have unprotected sex. So many times they forget that there are other STIs involved, not just HIV. So that's one of the biggest fear we have when it comes to PrEP, and the lack of the dialogue, lack of education. But I think we're all still waiting for new studies regarding with PrEP, because certain studies suggest that you only need to take it for a week. Certain studies suggest that you need to take it long term for efficacy to reach a certain percentage. But generally, I would still think that many people think it's a magic bullet, and if I'm PrEP, I can go and have as much sex as I can, and I can have unprotected sex. But it's an amazing tool if you are going to a relationship with someone living HIV. It's another added layer of protection.
Can you tell me a bit more of your organization? What do you do exactly?
My organization is Action for AIDS, and it's the only organization in Singapore that actively reaches out to persons living in HIV and run education programs. We also run the largest anonymous test site in Singapore at our clinic, and also the mobile van.
And how would you see the impact of the 377, the criminalized same-sex activity between consenting adults? on the
on
the
prevention.
work you do, prevention, and
It makes it tricky. It doesn't allow us to reach the people we need to reach. And there are so many MSMs who will never associate themselves with the term gay or go down to a gay club, to watch a show or something like that. So it definitely makes things more tricky. A couple of years ago, when I met a new friend, he was 17 then. He was just starting to explore his sexuality, and I remember very clearly one of the things he told me is, if it's in the law that 377A is there, and if the government doesn't support gay men, then there really must be true. There must be something wrong with me. And if young gay men are starting to being brought up this way and they think that there's something wrong with them, then there's something really wrong with the system. And by the time we reach them, sometimes it might be a bit too late, because they have already formed certain ideas of what sex is, or what it means to be gay, or what safer sex is, so to speak. And it takes a much longer time and much larger effort to change the behavior. And behavior change doesn't happen overnight, it happens over years, if we're lucky. And we don't have that platform that we can reach out to them effectively. So a lot of the money is wasted. The condoms that we have, when we distribute out to them, the kids cannot bring them home because the parents will go through their bags. And it's a system that continues to feed itself because the government has certain legislations. The parents pick up certain cues from them, and they form certain ideas about safer sex and what it means to be gay in Singapore. And then that feeds back into, and government uses that as an excuse, because then they will say that the society is inconservative and we're not ready to accept certain things. So then it keeps that feedback loop happening, and we cannot seem to break that feedback loop to let people see, or to re-educate what. Prevention programs hasn't changed much. We're still talking about the same things in more and more creative ways to work around 377A, the media laws. There's a great deal of condom messaging fatigue within the community, and so we have to come up with new ways to tell the same story for the last 30 years. When I joined the organization 7 years ago, there was only 3 full-time staff. We've grown quite a bit then. There's been a renewed interest from the community to want to do something for HIV and AIDS. Today, when I meet people who are newly diagnosed, they usually come and tell me that I've actually come out to a couple of my friends, I've actually come out to a few of my colleagues. So they're really starting to form their support network even before they come to AFA. So that has changed. The reliance on support groups have dramatically reduced. There are still people who rely on support groups.
And for you, how is it to be a gay man and living with HIV?
When I was first diagnosed with HIV, it was really uncomfortable, and I had to relearn how to have sex all over again. But it was really just to get comfortable. I was surprised to meet more people that were willing to accept was willing to have sex with me. Only one person wasn't comfortable enough. It was more about me learning how to get comfortable, more so than anything, because HIV has been a part of this community for so long now. They're bound to meet someone with living HIV somewhere along the way. Yeah. Community-wise, there's still that fear that people will reject. And yes, it still happens from time to time. But generally speaking, many people, more and more people are willing to explore it. Yeah, explore the fact that their partner could be living HIV and to deal with it. And because treatment is working so well now, the chance of transmission, if I'm undetectable, is less than 1%. And if I use a condom and practice everything I can, it's just virtually not possible. I think it's a very exciting time to be living with HIV and being gay in Singapore now. Stigma and discrimination aside, I think there are more and more people. The movement is gathering some speed, and we're getting quite a bit of support from everywhere. The fact that I get so much out of this job, and the fact that I can use my status to help others, I don't think I'll be still in this job for 7 years and still going at it. Yeah, so I think instead of making it, I'm just celebrating the differences in me. That I'm gay and I'm living HIV and I'm going to use it to my full advantage. And if I can help someone along the way, it's even better.